Now it should be working. Are you guys all set? Can you hear me now? Let me know on Facebook if you can hear me. I don't know. Yes, you can hear me now. Okay. I don't know what that's about. There was something that happened on my phone, and it turned off the sound on the Mac. Yeah, that makes sense. My computer needs a little bit of Tongren, but anyway. Okay, Rachel. All right, so let's continue on with our great option. Okay. All right, yep, I don't want to miss anyone. Interesting newbie, so let's continue. T8 for the pancreas, for the diabetes, and T7 for the spleen. Yeah, thank you, Rachel, for putting that up earlier. That will help a lot. I don't want to miss anyone. So that helps a lot. Thank you very much. So if people are out there curious, we've already got people signing up for the kind of the comprehensive community. So we're going to have the science of Tongren for people who want to go deeper. We're going to integrate a lot of quantum biology or quantum lifestyle into what we're talking about, because the goal is to create a comprehensive set of things, simple baselines of things, such as what I've just begun to start again, which are earthing mats and earthing sheets, as well as light therapies, watching the sunrise. But all of this relates to Tongren, because Tongren is about biophotons, and Tongren is about our streaming of biophotons to our consciousness and our intention. All right. So we have the word progression. So if we just took that chart and then progressed it to its final destination, could be maybe, let's give it 50 years. So 50. My sense is it's a slow progression, and then you're gonna slow it down. But anyway, we'll figure that out. We'll make sure it works. So David Kubera, tell me, are you doing better, worse, or the same? I know you're doing the craniosacral therapy. I know you're doing different things. So remember, you had some stress recently. And I have a cure for that test, the progression. It's one of these. So anyway, T1 to T8. And edema. So we work on lumbosacral plexus, the spleen, and then down the legs and feet. Liver 3 and kidney 1, and you're welcome very much. And Edna, how's your left foot doing? Is it better, worse, or the same? Left weak leg, ALS. So ALS, let's just go right to the ALS, the beginning of all of that process. Command points of the brain. This is a muffin. This is Ezekiel Flax English muffins, the best muffin in the whole world, from my simple perspective. You can put avocados, sprouts, as I do. Okay, then grounding. ALS, command points of the brain. Command points of the brain stem and blood flow to the brain. And inflammation, any itis, T1 to T8. So yeah, let me know what you guys think. The community will have all of this activity because, as I've done before, but now formalizing it and bringing it to a deeper level in a lot of ways to add as a resource for practitioners and clients and patients as well. Everything possible. If you're curious, I put a link in on the website there. In fact, I can actually put that link in the other area as well. Yep. All right, so let's continue. I don't want to miss anything. And yes, let's see, and we'll get to Charlie. By the way, Charlie, I think it's 9:30 on Mondays. Definitely check out Charlie. He's kind of an expert on all of this as well as diet and nutrition, and he joined us for a workshop recently, and he was great to have him there because he's so knowledgeable, and he's a great speaker too. All right, let's continue with the ALS, acid reflux, inflammation. And we're working with Edna and then Lynn next. And then we'll jump over to social media, other social media. The flow to the brain, and yes, T1 to T8. Respiratory weakness, and we're coming up to start to work also on respiratory focus for Catherine. So let's do respiratory, T3 for the lungs, CV17 for the lungs, and lung 1, lung 2. Lux local, sounds like a person who does quantum biology. So for everybody out there, what would be the things that you would want to see to understand more deeply, or to practice yourself, to help yourself, or to help others? That's the community. It's going to have everything interconnected community from an app called Circle, which is going to basically bring all the Tongren stuff to the world easier, quicker, more detail, articles, recommended books, have different types of things going on. And also blood pressure, GV17. Bulging disc, so whenever there's a bulging disc, make sure you're really, really hydrated, because the discs are basically little sponges. So you want to fluff up those sponges, yes. Okay, L3, L4. So let's do L2, 3, 4, and 5. So to support the other areas. A lot of times people ask, if they're interested in plant-based, quick ways, like for breads, Ezekiel breads, Ezekiel muffins, especially the flax types, and even wraps, which I do on a regular basis, and salads and fruit, lots of fruit. And then when you're done with the fruit, have some more fruit, and then you should be doing great. Science has shown the more fruit you eat, the lower your depression. Okay, bulging disc pain, we worked on that. 3, 4, body twitches. So let's work on the sores. The Mucuna pruriens herbs, Ayurvedic herbs. Have you started to take that, and is it helping? Hypothalamus is the command center for the endocrine system and the bioelectrical system. TV 22. Pain all over. Sorry to hear that. There's a great CBD mentholated oil, salve, Delta 8. It's really good. See if you can find it. If you can't, just let me know. And grounding to liver 3 and kidney 1. Hope you're feeling better, Edna. For ALS, I would highly recommend getting a device like Saluma for deep penetrating infrared light to reactivate the brain, whatever's going on. Always check, of course, for toxicity. Sometimes these are toxic shocks to the body, ALS. So check your heavy metals or toxins from drinking water or swimming water. That's been my understanding and research as well. And next we have Lynn and Catherine, and then Happy Mama. So let's do it. 3-part process. Lux Local. Is this your first time here? Blood flow to the brain, brain command points. So let's work on the cranial nerves, GB 7, 8, 9, 8, 9, 10, and 11, to activate the cranial nerves. What's up with what's going on for the cranial nerves? Occipital ridge. So let's do the 3 blood supplies. Carotid artery, vertebral artery, and occipital ridge. And the occipital artery and left eye. So C3, left side, side of face, and top of head feel cold and strange. Lots of ginger, and then the brachial plexus. Facial nerves, both sides. T1 to T8 inflammation. So let me know what you guys think. We got the sound going. Leonard, good to see you. Yes, Charlie is awesome. We worked together on the convention. So yep, definitely reach out to Charlie. I would suggest that you listen to him each week. He's really got a deep understanding. He does a great job. So, cannot hear. Okay, so let's get to it. See, we got the Alistair Crowley, Tracy Overbaugh. So let's do it. We are now on Facebook. Somewhere on Facebook. Let me ask Mr. Zuckerberg. Cataracts. Are you doing better, worse, or no change? I learned something interesting. I eat simple, plant-based, and years ago there were some signs of cataracts, but I've learned that that could be caused by blue light in our devices, because the aggressive blue light in our devices can negatively impact our cataracts, especially if you do it 35 hours a day like I do. So these are blue blockers. So I'm going to wear these. See if you like them. This is blocking blue light so that my brain, my hypothalamus, what they call the suprachiasmatic nucleus, is not being triggered to think it's daytime and to understand now it's nighttime. The night shift has begun. So let's work on cataracts. Don't forget the Cataract Cure book and NAC drops. Going to work on the ouch point for the eyes, and also for Catherine, respiratory and macular degeneration. So the ouch point for you guys. So I hope you enjoyed your grocery shopping. Brain command points. So C3, C4 for the eyes, blood flow, facial artery for the eyes, ouch point for the eyes, liver organ for the eyes in Chinese medicine, mouth, dental bones, also C3, 4, and 5. And we are going to work with Tracy next. So macular degeneration, GB17 for blood pressure for the head, C3 for Catherine, T1 to T8, any inflammation or degeneration. And Tracy, tell me a little bit more about the rickets. Is that for you or for someone else? How long has it been, and what do you think of the causes? It is quite unusual, but we will work on it. Definitely work on superfoods like wheatgrass, spirulina seems to be the choice, sea vegetables, all these different things which are loaded with minerals and vitamins. Hot flashes, GV20. So when you say hot flashes, you mean what? If you give me more details. Unscheduled or continuous, never stopping. And to answer your question, Momashari, yes. Would I do a 1-hour cancer prevention class for the private group? Absolutely. I have quite a bit of information for that, and that would be a good option, I think, so much. And welcome also Sunrise. And we have quite a few people on social media. So my glasses are orange on purpose because they're blocking out blue. Blue light is the new disease of the future, or the new cause of deficiency in the future. And as I say, welcome Sunrise. And next we have, so we'll continue, rickets, digestion, absorption, elimination, T9 to T12, balancing hormones, and heartburn. And blood flow, nerve flow to the right toe. T7, lumbosacral plexus, and the ouch point on the right side. Joint is locked. I would definitely see a chiropractor to unlock that joint. T1 to T8 for Tracy. Area behind the throat that was earlier, I just don't want to miss that. That is the throat chakra area. And grounding to liver 3. Yes, sunrise. Glad you got the message. Should be arriving Monday, my guess, because today's Friday. So I will fix all of that. I hope you're doing better. Let me know if there's anything in the world that I can do to help you, Sunrise, and you guys. That's the other reason for the community, because we want to team as a team, a global team. And I'm going to bring in experts, people that I've interviewed over the years to give us help and all these different things to raise the amount, the level of information for people, as well as all of you to contribute to be a cohesive unit to help more people as a global village type of initiative. That's really what we want to do. So now let's go to Instagram. We don't want to miss. Whoa, we got quite a few people on Instagram as well. So let's work with Rachel right now. Rachel, 3280. Here we go. For you, Mom. Moms are the sacred people. Blood flow to the brain. And you said that they've written her off. Don't ever do that. Having worked as a caregiver for my mom, visits to the doctors, sometimes their attitude is, well, they're old, who cares? We don't have much we can really offer you guys. And that is not the right attitude. Up until the last breath they take, we must honor them as their sacred duty has been fulfilled. Blood flow to the brain. Command points to the brain. Lung cancer. I hope you're improving, Sunrise. T1, T3. T3 for the lungs, for lung cancer for Sunrise, and for Rachel's mom. For the brain. There's a special remedy. I think this would be a good fit for you, Sunrise. I have a sample here. 2 feathers, herbal formula. A person, there are prevention and there are remedies. And we could, that's from a First Nations Native American person, 44 years experience with cancer. So many cancer things, many cancer options. Yeah, and Momashari, let me know how many people, about the time. Yeah, I've done things like that before for people. 1 hour, if 1 hour or 90 minutes, if that works. For questioning, good to set aside some time for questions. There are some basic baseline things that people need to know about. Lungs, brain, 3 blood supplies, also for Augustina. carotid artery, vertebral artery, and occipital artery. Abdomen and adrenals, spinal fluid, craniosacral fluid for happy mama, perfect blood. Craniosacral fluid of the brain, brain stem, interface, T1 for the bones. So also C6, C7, thyroid for sunshine, and also craniosacral fluid as well. S1 to S5, tailbone 1 to 4. So for anyone that's ill, not really eating well, clay baths, clay foot soaks is another way to mineralize the body indirectly, and it works really well, and it helps to detox the body. So that's another way to help people, to support them. Essential oils, the vaporizers, types of things. Anxiety, GB13 right side for okay. And grounding to liver 3 and kidney 1. So let me know, David, how the intracranial pressure is doing. But let's continue. So let's do a few more for Rachel and your mom. Dizziness, GV17. White blood cell count, maybe an infection, T1. So which is also good for kidney function, L1, 2, and 3. Cancer metastases, or cancer from spreading, Dr. Rath micronutrients is one good option. Biomats is another option. And you're saying the shunt is working, which is great. So if your doctor isn't giving you good advice, get another one. Not easy, but you got to really just prioritize. When I was a caregiver for my mom, I fired many doctors. I just didn't work with them and worked with somebody that supported her, including a home-based doctor, came in with home visits. And good luck with all that. Your mom is 73. and grounding to liver 3 and kidney 1. But David, let's work on the intracranial pressure some more. Craniosacral fluid, the brain, 3 blood flows to the brain, carotid, vertebral, occipital. Balance, GV17, and coordination, GV17, BL9. Let me know if you're doing better, David. Okay. So let's continue on. Let's take a look at the website there. We will do some more for Happy Mama and Laura and Paris. Blood flow to the brain. Command points to the brain. We always think of the brain-wound connection, the brain connecting to the target area. Communication link needs to be reestablished, and the brain says, get working, do better, remove toxins, get in oxygen, all these things. Perfect blood, craniosacral fluid, supporting the bone marrow. And let's see, special events, replays. T1 to T8 for anti-inflammation, the lymph, T3. And we'll do a complete lymph tune-up for Happy Mama and everyone else. TB13 right side for Laura. It sounds like Laura's on track, doing great. Happy to hear it. Balancing hormones, GB20 and 22. Hypothalamus and pituitary. Abundance comes from connecting to your true self. So we work on the Intang, third eye area. And yes, Rachel, your mom is only 73. Long way to go. We need to keep them around. So if people are curious about the community idea, there's a link on the website and a link in the internet area as well. But let's continue with the Happy Blood, which is the blood production, so GB39 as well. So let's work for Faris's mom. So it's touching that all of you are working for your parents, which is great. I get that. There's no better duty than to take care of the parents, the people that brought us into this world. And from my perspective and my philosophy, we choose our parents, no matter how painful it may seem at times. They are our teachers, and we choose them on these journeys, life by life, or eventually enlightenment, as they say in Buddhism. So T1 to T8, also for inflammation and flu, but especially T5 for the arrhythmias. And low pulse, GV17, C1 to C7, cervical spine. T1 to T8, clear virus. Yes, hello, Joanna. Yep, HPV virus and the flu, T1 to T8. And happy guess. Blood flow to the brain, 3-part process. Command points to the brain, command points to the brain stem. C6 and C7, Hashimoto's tune-up. And charge the batteries. So let's charge all 3 batteries. Upper battery in tongue area. Middle battery, heart chakra area. Lower battery, CV17. And then tap for the left hip and knee. So blood flow, nerve flow. T7, lumbosacral plexus. Blood flow to the brain. If it's okay, Omashari, I'd like to put that into kind of document these things that I don't do so well. I'll put it in kind of a testimonial if that's okay. But yep, we've been working together for 8 years. Wow. And you are doing stellar. You did a lot of good work yourself. You worked at it really hard. So we have what Momashari said here on Instagram. Joe tapped for me privately for years, starting in 2016. Tapped for me in the hospital in 2018, and I surprisingly recovered from issues. You still have CLL and on the lowest dose of medications. That's 8 years, coming on 9 years. Power of Tongren and the power of hard work for Momashari on her part and her family. And you are in remission. And yeah, if anybody wants to get in touch with me, email me or text me. Okay, and then grounding, if we did the left hip, blood flow, nerve flow for the left hip and knee for happy guest. So let me know, Rachel3280, if you have my contact information. And never give up. That is correct. Laura is doing great, which is perfect. Hope Sid is doing okay too. Rachel, you're in the Boston area. I'm in the Boston area. I'm in Quincy, just outside of Boston. (2016). Mamashari, you're awesome. You did a great job. I'm just a support facilitator. You did all the work. Okay, so let's continue on. Hello, Leonard. Caring creature. That is correct. Yep, and I highly recommend to see Charlie. I think it's Mondays at 9:30. Get as many classes as you can. Just do a whole bunch. Depression and scoliosis. So add your fruits, vegetables, fermented foods. Scoliosis, yes. So we work on releasing the muscles so the spine can find its center. So, timid newcomer, yeah, if you could drop a link in, I'll check it out. I'll email me a reminder, Gaia, called The Creative Play of Consciousness, because I'm also curious. They have what is called photonic optical communication in the brain, which is basically biophotons and accelerated bioelectrons. So it's good stuff. So Gaia, and it's called Creative Play of Consciousness. And the nature of identity and reality, about a 1/4 way through. Photons, entanglement, all good stuff. Good to see the Tongren concepts on TV. Yeah. Blood flow to the brain. Tap for the dog. You have the tumor on the buttocks. So I would do clay, diluted clay, do wheatgrass drinks, diluted for the dog, and then also clay poultice. And hello to Harley. Blood flow, nerve flow to the brain. And then for everyone with cancer or tumors, oxygen protocol, phrenic nerve. Lung 1, lung 2 also. And the ouch point on the gluteus area for the tumors. So lumbosacral plexus, blood flow T7, nerve flow lumbosacral plexus, and ouch point, a 3-part process itself. And grounding to liver 3 and kidney 1. Tell Harley I say hello. So Edna, left foot is better, so trying to walk with a cane instead of a walker. Good for you. Keep up the good work. Everybody's here on your side. Need to adjust your balance. So they have different things for for balancing your brain left and right side. So when you cross your hands, your brain learns different things. When you cross your legs from one side to the other side of the central line, it will realign and reconnect and correct your brain balancing signals. So sunrise, keep me informed. Next scan, December 18th, is going to be okay. No matter what it is, you're a hero, kid. You're going to do fine. If there's anything I can do to help you, just let me know. If I missed anything, remind me, and then we'll just catch up. Okay, so let's continue on. So Edna, the name is cell, like in cell of the body, cell, Celluma, Saluma, I think is what it's called. Okay, so let's work with Edna, Christina, endometrial, peritoneal, blood flow to the brain. It's always good to integrate some good meditations. I would highly recommend Joe Dispenza meditations to learn how to take your consciousness and create a new future consciousness. Walk into the future. So, blood flow, so oxygen, sky window, CV17, and then liver T9 right side, peritoneal, tailbone 1, 2, 3, and 4. So for any airway constriction, exercise it with resistance breathing. There are devices even for that. If anything, it will increase the efficiency of whatever oxygen you have. As I had a cancer patient who lost half his lungs, couldn't walk up steps without stopping and breathing and inhaling. Eventually he used the relaxator and was able to walk up within 2 to 3 weeks steps normally and forgot to stop. Endometrial, so again, lumbosacral plexus nerves. Lung 1 to 5, sacrum 1 to 5. T3 for the lungs, lung 1, lung 2, and CV17 for the lungs. Yep, Celluma. Check it out, Edna. And your IG is acting up, Momashari. I would definitely recommend aloeanswers.com aloe vera juice. I can send you a link that actually you can use my link. There's 15% off for that. Medical grade aloe vera juice. And Andrea, blood flow to the brain and brain stem command points. Lower back, blood flow, nerve flow. blood flow, nerve flow from a fall, and neck pain as well. So let's work right on the muscles of the neck for Andrea. C1 to C7. I would recommend to see a chiropractor to make sure everything is in the right place. Then see a massage therapist to make sure it's blood flow and nerve flow and enabled enough. Let me know, Edna, if you got the Saluma website. So Tracy and hypophosphatemic rickets with hypercalciuria. Sounds like an absorption issue. I would definitely improve. I would do some detoxing with clay. I would do some fermented foods, high fiber foods, and sea vegetables. Blood flow and red light therapy. So T1 to T7, T1 to T8, and let's work on the gut for Mumashari. And digestion, absorption, elimination also for Tracy. So for osteoporosis, there's a process that I've come up with for people. One of the main deficiencies in osteoporosis is silica, and some are more efficient than others. One type of silica developed in France in the 50s and 60s, hyper-absorbable, along with special herbs, Cissus quadrangularis, so remember, genes only do what the environment tells them to do. So if you change the environment, they'll do different things, or they won't do anything if it's a negative action that they might be doing. So you are in charge. For the bones, T1 for the bones, GB39 for the bones as well. So there are two Native American First Nations herbal remedies that I always recommend. For cancers. Healthy GI for Pat. Occasional hot flashes, GV20. T1 for the bones and GB39 for the bones for everyone. Kidneys for hypercalciuria. Okay. Christina, your question, can you get SEACT from me? Yes. In all my research of 25 plus years, I found the most advanced SEACT, actually the most researched, and most case studies based upon the actual original formula from Nurse Casey herself. So I highly recommend to get the one from my website. Whatever you need to do to get it, I send it to people as well. So Marie, gut health, is it doing better? Tim Keys for cataracts, wound care, and different things. Okay, here we go. I don't want to miss anyone. We're running a little bit late. We had a little bit of technical difficulty at the beginning, but we will go forward. Yep. So Sunrise, keep me in touch. Let me know what's going on, and we can jump on Zoom and make a plan for you. And also put in the chat or the discussion if people are interested in joining the community kind of support, global village kind of support, 40%, just to get people in there to communicate to each other, because I learned from all of you as well. And we'll be having weekly live events, bi-weekly live events, monthly live events, support calls. Healthy GI for Patricia. ALS is all about the brain. Command points of the brain, command points of the brain stem, and blood flow to the brain. And welcome Dorothy and Kitty C. Macular degeneration, C3, 4, and 5. Ouch point on the eyes, and blood flow, facial artery, carotid artery for the brain. Hope you guys can see me actually. My goodness, all that time I'm starting to slouch. Ouch point for the eyes for Dorothy as well. Sciatic pain, I would recommend pigeon pose or modified pigeon pose. That will release that. But T1 to T8 for the sciatic pain, inflammation, and GB39 directly, that is the master point for releasing the sciatic pain. And knee pain, blood flow, nerve flow, brachial plexus, lumbosacral plexus rather, and GB39, bladder 54, which is also good for knee pain. So let's make a quick jump back to yes, there are some grounding mats that are better than others. And we will also work for Sunny Gem, detox from mold, smoke, and chemicals, blood flow to the brain. Let me see if I have the mats. Oh, doesn't look like it. So then for Sunny Gym, mold, smoke, and chemicals, science and lungs. Sinus and lungs, blood flow to the brain. And we will finish this up in just about a minute for everyone. 1 more minute. Detox from mold, T1 to T8. T1 to T8, lung infections. Also T3 for the lungs. T3, 4, and 5, sinuses. CD17 for the lungs and T9 for the liver. GB13, right side. And grounding to liver 3 and kidney 1. Okay. And we have a few more. Make sure we didn't skip anyone. Marie, you're next. Marie and Tim. And Kitty, Marie, and Tim. So blood flow to the brain. Command point to the brain. Command point to the brain stem. Blood flow, nerve flow to the spine, and cataracts for Tim. C3. Get some blue blocking glasses. Check it out through your dowsing. Oh, and Marie, I'm sorry, I missed the word. Continued good gut health. Yes. T9, 10, 11, and 12 for Marie. A round of applause for Marie. Butyrate. Think butyrate. Yes. And MD also for Tim. So let's work on the entire spine and the craniosacral fluid for the MD. Craniosacral fluid from the brain. T1, sacrum 1 to 5, tailbone 1 to 4. Red light therapy. Grounding to liver 3 and kidney 1. So let me know, Edna, you got the name. Yes. Yep. Sunrise, whatever you need, let me help you out. So Tracy, let me know. Yeah, there are certain places to get the silica. If you have my email address, I think we've communicated before by email. I'll send you links to a couple of things for the bones and bone marrow and different things, and the community as well. So here's a link to the community for people that are curious. My goal is to be more information, more help, more support for everyone, more interaction, more engagement, so I can get answers for people, and even if I can't answer them. So Tim, T1 to T8. And for everyone, liver 3, kidney 1. Engagement is good, and you will be my coach. And grounding to liver 3 and kidney 1. Wow, we went over time. We had technical difficulties. It's almost a full moon. Yeah, that's it. And we're eating muffins. Oh, what could go wrong? So here we go. Qigong for everyone. Take a deep breath, breathe through the nose. And I want to make sure I didn't miss anybody over here. I can still work on them with the Qigong. Yep, we are complete. We did not miss anyone. Yeah, get in touch with Tracy, and I will give you, this is a very specific liquid. I take it myself, liquid silica. Silica is a precursor to collagen. Collagen is the basic starting ingredient for all bones and tissues. Along with that, you need vitamin D, K2, an herb called Cistus quadrangularis, sea vegetables, bone resistance, bone pressure from exercise, and I would recommend red light therapies, or just watch the sunlight. Merci. Numero 3. Thank you very much. Sorry to hold you all up. Thank you and have a great day. And thank you, Mama Shari, for reaching out to Rachel. Really appreciate that. That's how we support each other as a community. When people are having challenges, community makes it easier, makes it stronger for everyone. Thank you, and have a great day. Blessings.